that is a group of homogeneous sample is taken and height and weight of the each group had correlation coefficient of 0.6. So, we all know that for the correlation coefficient we make dot diagram or scatter diagram. For example, this is the group A, okay, 4 groups are there. So, this is the correlation coefficient of 0.6 of group A, this is the correlation coefficient of 0.6 of group B, this is the correlation coefficient of group C, okay, and this is the correlation coefficient of group D, okay. This all have correlation coefficient 0.6, okay. So, what the literature says about the homogeneous sample if taken about the correlation coefficient of combination. So, the combining correlation you can take appropriate averaging methods, okay. These average methods are appropriate when taken several different sample for a homogeneous sample, okay, same population, okay. So, if the homogeneous sample is there, you can simply take average of all these 0.6, okay, 0.6 plus 0.6 plus 0.6 and these are 4 samples. So, divided by 4 it equals to 0.6. So, our answer should be equal to 0.6, okay. It is a very simple question, but asked in the tricky way, the way of the INI-CET, the tricky questions, but it is simply solved. You do not to do so many statistics formulas are there, simply you have to make an average of that, okay. Another question related with the clinical trials. So, clinical trials are very important for INI-CET. We see that which of the following studies will show the equivalence of new drug. So, we should know what are the superiority trials, inferiority trials, or the trials of equivalence, okay. These are 3 kinds of trials which is usually done in the clinical trials. In the superiority trial, for example, this is the limit of superiority, it is also known as plus delta, and its limit of inferiority is called minus delta. So, if any drug, the study if lies here, the results are lies here, the new drug, for example, drug F is lies here in the above beyond the line of superiority, you can see that the drug F is superior, okay. Drug F is superior to the drug older drug, okay. And if any drug is lying here, for the drug G in the inferiority beyond the line of inferiority, we can say that G is inferior to old drug, okay. So, the language is like that, that F is superior to drug old drug or new drug G is inferior to old drug. So, when the superiority and inferiority trials are there, we can expect result here or here, but sometimes results are here, for example, drug O. So, it is not beyond the line of superiority, not in the zone of equivalence. So, the results are inconclusive. Or if for example, here A and B are showing below the equivalence, but above the inferiority. So, it is inconclusive, or you can see that it is as good or it is very much, you cannot say that it is inferior or it is equivalent, okay. But if any drug is lying here, okay, for example, here C and D are lying, okay, a part of C is in the zone of inconclusiveness, but a part is in the equivalent. So, we can take, we can say that this C sometimes show the equivalence. So, it is as good as old drug, okay, it is as good as old drug. So, these both C and D are in the zone of equivalence. This E is beyond the equivalence. So, E is not included here. So, our answer should be C and D, okay. This shows equivalence of new drug, that C and D are showing that these C and D drugs are as good as old drug, or you can say that it is a trial of equivalence, okay. It is not superior, not inferior, but it is as equal to the old drug, okay. So, that is the trial of equivalence which is asked in this question, okay. Which of the following criteria is not in the criteria of essential drug? It is only question. So, we should know what are the essential drugs, okay. Essential drugs are frequently asked in the questions. and essential drugs is useful in your future as well, that you should know what are the essential drugs. Government is also saying that this is the essential drug list, it is in the essential drug. So what should be included in the essential drug list? A WHO essential drug list is already there. Okay, WHO essential drug